Good morning, good afternoon and good evening. I'd like to say a very warm welcome to you all. Many thanks for joining the webinar today, which is going to be on the topic of perspectives on motorcycle and three-wheeler use in sub-Saharan Africa. We'll be focusing particularly today on before and during COVID-19. We've had 79 people registered for today's webinar, and I can see that over 40 have already joined, and no doubt many more will join in the next few minutes. We have people with us today from Tanzania, Kenya, Zambia, the UK, Ireland, Madagascar, Brazil, Liberia and Ghana, to name just a few. A very warm welcome to you all. Next slide, please. So today we'll have a couple of speakers. There'll be myself, Caroline Barber. I'm the Chief Executive at Transaid, and we have one of the Transaid project managers, Kim van der Weijde, who looks after a range of our health programs, and she'll be talking about some of the research that she was involved in on two and three wheelers. I'm also really pleased that we are today also joined by a panelist of experts who will be able to draw on their expertise when we come to the discussions part later on. So really pleased that we have Dr. Nono Mvuama, who's joined us from the University of Kinshasa in the Democratic Republic of Congo. Dr. Nono is a physician who works at the School of Public Health, and he and his team have been involved in some of the research that we've done. We're particularly pleased that he's joined us today, which on Independence Day, so a national holiday. So many thanks and a warm welcome to you. We are also very pleased to have Mr. Kevin Mubadi with us today. And Kevin is the chair of the Boda Safety Association in Kenya. Really pleased he's joined. He'll be able to share some really important perspectives of what he and his association are doing on the ground. And finally, we have Ms. Grace Wahome, who's from the IFRTD, the International Federation for Rural Transport Development. And Grace was also our national expert on research conducted in Kenya in 2017 to 19. So huge thanks to our panelists who will be able to draw on and bring a lot of insights from the ground to the discussions later. With the way that we set this webinar up today, we won't be able to take audio questions from the floor, but we will ask you to post questions as you go. You can do this at any time in the question function on the right-hand side, and just press send, and then my colleagues will be sending them through to me later, and we'll get through as many of those as we can. So we have quite a short agenda for today. We'll be presenting on the two and three wheeler research that we did, implications of COVID-19, and then we'll be moving into allow plenty of time for question and answer session. Next slide, please. So just to give you down to Transaid and the two and three wheeler research, looking at the people who signed up for the webinar today, I can see there's some people who are already known to Transaid, but it's also wonderful to see some new names there. So for those of you that we don't know yet, Transaid is an NGO that's been working for over 20 years to transform lives through providing safe and sustainable transport services. We continue to support communities and the sector during COVID-19, and I'm really proud of the way that my team and colleagues and partners have really been able to rise to this new challenge that we're all facing and ensure that communities in the sector are supported at the right time and not forgotten despite all the other challenges. In 2017, we were commissioned by RECAP, and RECAP is the Research for Community Access Partnership, which is funded by UK Aid, and it is managed by Cardno Emerging Markets. We were commissioned to undertake research on two and three wheelers in sub-Saharan Africa. So as part of this research, we partnered with Amend, who are a wonderful road safety organisation working across Africa. We also worked with the Transport Research Laboratory and the University of Kinshasa. So we worked in 5 countries, and we had a national expert who led the research in each of the countries. And really what we want to take the time today is to sort of put a lens on motorcycle taxis and three-wheelers. They really do provide a vital transport service to millions of people in both rural and in urban settings. And today we want to reflect on their role both before and during COVID-19, and consider that some of the implications that the pandemic has had on this, which is often a very informal sector. And we hope that we can share some insights, reflect on these, stimulate some interesting discussion, and maybe start to develop some really practical strategies that can help guide the way forward. So at this point, I'd like to hand you over to my colleague, Kim van der Weijde, who will tell you more about the research. Thank you so much. Over to you, Kim.
Hi, everyone, and thank you so much for joining this webinar. As Caroline said, I'm going to briefly take you through some of our research that we've done together with recap on motorcycles and three-wheelers, and then we'll have a look at how COVID-19 has impacted the sector as we've seen from our partners. So the research that we did was really to understand the benefits and disbenefits of the use of motorcycles and three-wheelers in rural transport, their safety, and the implications for training and having an appropriate regulatory framework. And we wanted to really allow motorcycles and three-wheelers to operate safely and to help provide access to good, affordable, and inclusive services in rural areas. The 5 countries that we worked in for this research were DRC, Ghana, Kenya, Tanzania, and Uganda. Next slide, please. So how we carried out this research was we would do a literature review of each country before the primary data collection to understand what was already known and to do a thorough stakeholder mapping. And these stakeholders are really key throughout the entire research. The primary data collection was made up of riders, passengers, owners of 2- and 3-wheelers, then also owners of freight who might use 2- and 3-wheelers, and non-users. We covered quite a broad range of subjects, including their overall perspective of 2- and 3-wheelers, their thoughts on economy and finance, and such as their income from motorcycles and 3-wheelers or how much expenditure there might be, how motorcycles and 3-wheelers related to access and mobility within rural areas, how riders and users perceived and experienced injuries and health, what kind of crime and personal security issues they might face, and as well, what kind of access to services and personal protection equipment they might have, especially riders to training and to licensing and insurance. Next slide, please. But why did we focus on motorcycles and 3-wheelers to begin with? As many of you might know, 3-wheelers and motorcycles have seen a really great surge in their use in sub-Saharan Africa, and they offer really significant social and economic benefits in rural areas. They are often the only means of motorized transport in these areas for communities and for the communities. They can help provide access to medical facilities, education, markets, and generate an income. However, on the other side, authorities have struggled to develop and implement an appropriate regulatory system that is keeping up with this large influx of motorcycles and 3-wheelers. And we've also noticed safety issues related to their use. Next slide, please. You can see here the 5 countries we've worked in. We really did try to reach a broad geographic range throughout each country using multiple sites. Next slide, please. So I'm going to briefly take you through some of the key results that we gathered. And some of these are quite interesting as they relate to COVID-19, which we'll discuss later as well. So you'll see on the left is the percentage of riders who claim to always wear a helmet. And aside from Tanzania, across the board, this was quite low, averaging between 20–40% with the exception of Tanzania. And then with passengers, this was even lower oftentimes than the riders. Then in terms of percentage of riders who had undergone any formal training, you can see that Kenya at 19% was the country with the highest attendance to formal training, while the others were very, very low. Next slide, please. And so we asked the riders, why have you not undergone any formal training? And largely, because we were in rural areas, they just said that there was no training available in their area. And otherwise, training might have been too expensive. And in some cases, riders did not feel that they actually needed any training, that they were trained by family and friends or self-taught. Next slide, please. We also tried to investigate how common it was to have been injured while riding a motorcycle. And in blue, you can see the riders who had claimed that they had been injured in a crash, So quite high, between 30 and 50% of riders had been injured while riding a motorcycle. And then as well, passengers, approximately between 8 and 18% of passengers had said that they had been injured in a crash, which is quite a significant number. Then riders also cited quite a lot of health issues attributed to riding. You can imagine this as back pain, problems with vision, but also what's quite relevant to COVID-19 is a large number of them said that they had respiratory problems, which we have to keep in mind as well now in this COVID-19 response. Next slide, please. However, motorcycles are also very commonly used as a form of emergency transport in rural areas. So you can see in blue are the riders who have transported a passenger to a health facility in an emergency. And you can see that even in the country who reported this least, in Ghana, it was still 76% of riders who said that they had transported a patient to a health clinic or a hospital. And then in terms of passengers, they also had a very high rate of users who said that either themselves or a household member had used a motorcycle for emergency transport. So you can see that they really are a critical aspect of the health system as well. Next slide, please. So unfortunately, we don't have too much time to spend on the results from the recap studies. However, I'd just like to point out a few interesting facts, especially those that might be interesting for the COVID-19 response. So in Ghana, motorcycle taxis are officially banned. However, they are still used, especially in rural areas. And they had the highest injury rate, which is quite interesting if we jump over to the right side on Kenya, who had the highest proportion of riders who had a driving license and insurance, and the highest proportion of riders who first learned to ride in a driving school, had the lowest proportion of riders who had ever been injured. So we can start to correlate that maybe this driving license and insurance and training might be beneficial to less injuries. In DRC, riders had the highest level of education that we had seen in any country. Riders often had secondary or university degrees, and also earned nearly 300,000% of the national average, 3 times the national average compared to other forms of work. And in Uganda, use of motorcycle taxis is legal, but the use of motorized 3-wheelers is illegal. So that's also quite important to keep in mind. And then in Tanzania, it was clear that attempts by authorities to impose control over the motorcycle taxi sector had been unsuccessful. Next slide, please. So for each country, we did try to make several recommendations to how the sector could be improved. And in many of these sectors, they were quite similar. So for example, improved collaboration between stakeholders, especially governmental and private organizations, who oftentimes may not work together or even be opposing each other. Improved regulation on helmet use for riders and passengers, self-explanatory, to decrease the number of injuries and deaths on the road. Sensitization through associations to address rider compliance and behavior. So associations were often very well attended in many of these countries and very well respected. So that was a great alleyway to use to improve the sector. Strengthening the quality and availability of training and introducing training standards. So having a minimum training standard in many of these countries, we believe would very much improve the quality of riding. And mandatory training prior to obtaining a license as well to improve the standard of riding. Driving schools' capacity and accessibility in rural areas should be increased, especially because many of these riders felt that they couldn't reach any kind of training. Legislation of motorcycles and motorized 3-wheelers on low volume rural roads. So very much focusing on countries here where that is currently illegal. And then the enforcement should be applied gradually, supported by sensitization activities to really support riders in following legislation and regulation. Next, please. We did release several resources that might be interesting to this audience, and they're all downloadable on the Transaid Knowledge Center and the Recap Rural Access Library. These include policy briefs and reports of each country, but also 2 manuals, an instructor's manual to help support that minimum standard of training, as well as an associations manual to help support guiding associations with the riders and really representing their riders well. Next slide, please. So that was a very brief overview of some of the research we did, and I'd like to compare this now to some of the observations that we've received from our partners during the COVID-19 epidemic. I'd like to say that we have not completed any formal research on 2- and 3-wheelers yet during this time. However, we would just like to share some of these insights as we think that they're all very, very informative and interesting. Next slide, please. So what is the actual condition of COVID-19 in these 5 countries that we're speaking about today? In Ghana, the rates are, in all countries, the rates are currently still increasing, with exception of Tanzania, which we'll get back to. You can see in Ghana, currently, this is data from yesterday, they had nearly 17,000 cases reported. In DRC, nearing 7,000 cases reported. Kenya, nearing just over 6,000 cases reported. Next slide, please. And then in Uganda, where the numbers are still quite low, about 859 reported cases. And Tanzania, as many of you know, have stopped reporting on the number of confirmed COVID cases since about end of April. So you can see COVID-19 is very much still a reason of concern in these countries right now. Next slide, please. So what you're looking at now is quite a busy slide, however, very important slide. It is comparing the situation of 2- and 3-wheelers of each country with various questions relating to COVID-19. So I'd like to take you through these. First of all, in all countries, it was still evident that motorcycles and 3-wheelers were still operating. So we asked them a few simple questions. First of which, have there been any new restrictions or regulations put in place because of COVID-19 or in response to that? And what you can see is that many of these countries have restricted the number of passengers. So for example, in DRC and in Kenya, 1 passenger per motorcycle, 2 passengers per tricycle in DRC. In Ghana and Uganda, a ban of carrying passengers. In Ghana, this is not a new regulation. However, in Uganda, it was a method to control COVID-19. And in Tanzania, no real additional regulations of that sort. And also, many countries were putting in place regulations or recommendations in terms of PPE, or personal protective equipment. So you can see in DRC, requirement to wear a face mask. This is the same in Kenya and Uganda, and in Tanzania also recommended. In Kenya, actually, they've got quite strict standards now on how to maintain sanitary conditions on the motorcycle, including water tanks and soaps, and having clean seats, and using only mobile money when dealing with passengers. We've also seen some increased police checks and arrests and curfews as well put in place. So what we've then asked these countries, what has that effect been on demand then? And it's been somewhat mixed, and it's evolved over the epidemic. So in DRC, there's less demand in central business areas of Kinshasa. This makes sense because there has been restriction on movement and lockdown. In Ghana, it's been somewhat mixed. Some use less motorcycles. Some passengers find motorcycles safer. Kenya, at first, where there was less demand, this has now started increasing again. In Tanzania, a higher demand because there have been restrictions put in place on other modes of public transport. But in rural areas, there hasn't been much of a change noticed. And in Uganda, some must use motorcycles if there's no other form of transport available. However, riders do face a risk of impoundment of their vehicle. So since there is still use, but all of these restrictions, how has this impacted the rates that the riders are charging? And you can see in DRC and in Kenya, the rates have doubled for motorcycles and about 2/3 increase on tricycles in DRC. But then on the contrary, in Ghana, it's actually the riders who are suffering because the passengers are refusing to pay because they're not able to due to economical restrictions. In Tanzania, in rural areas, there has not been much of a change, and the same has been noticed in Uganda, although other forms of public transport have seen an increase in price. We wanted to also understand the perceptions and fears of riders and passengers surrounding COVID-19. In DRC, passengers are frequently demanding riders to wear a mask, and refuse to ride with more than one passenger. In Ghana, it's mixed. Some fear COVID-19 and some do not. In Kenya, there is certainly awareness and some fear, but some riders believe it is a rich disease and so that they will not contract it. And some passengers prefer to continue splitting the cost, which means having more than one passenger on board. In Tanzania, in rural areas, they are less aware or concerned about it. Among passengers, this could be due to the fact that there have not been as many observed cases. And so many times they believe it's focalized in the cities. And in Uganda, it's also mixed, but also not as many cases, which may be easing the concern. For these riders and passengers, is PPE available? So when we speak of PPE, it's mostly masks, but could also be sanitizers or washing stations or things like this. So in DRC, their masks are locally produced and they have to be purchased by everyone themselves. In Ghana, they're also available masks. In Kenya, hand washing stations, sanitizers, and masks have been provided by associations such as the Boda Safety Association. However, we've heard that otherwise that there's not too much provision of PPE, especially for riders. In Tanzania, there does not seem to be a lot of PPE available in rural areas, although we've heard that in places like Zanzibar, there are NGOs supplying motorcycle stands with some protection. And in Uganda, cloth masks are available as well, where we've also gotten a good price indication of good and poor quality materials between $1.20 and 30 cents. And they've also been piloting some other ways of protecting themselves, like a motorcycle screen, which we'll show you shortly. Has this PPE been worn, even if it's available? So in DRC, riders do have masks, but only wear them correctly with passengers and police. This is what has been observed. In Ghana, face masks are being worn by riders and passengers, but helmets more limitedly because they don't want to share them. And in Kenya, increasing as this distribution takes place by the Boda Safety Association. And that is, of course, also coupled with some sensitization, which we'll get to in a second. Tanzania, in rural areas, is not really being worn, as has been observed. And also in Zanzibar, this is quite limited. And in Uganda, about 60% of riders are wearing masks, but more on highways and city centers. And so the last question we asked is, are motorcycles and three-wheelers receiving targeted sensitization? And across the board, with the exception of Kenya, this is not really being done. There's general sensitization over the radio and over the TV, but nothing that's targeting these riders. With the exception of Kenya, as I just said, who the Safety Association is actually doing quite a lot of sensitization with their distribution of materials. Next slide, please. So then we asked them, what is the overall impact of COVID-19? So this is us asking of our partners, of course, and these are some of the responses we got. So in DRC, motorcycles and three-wheelers are still operational, but in less capacity, especially for motorcycles. Social distancing is becoming difficult because of the lessening capacity of motorcycles. People are having to gather to wait for transport, and passengers find it harder to pay for transport services. In Ghana, motorcycles taxis still officially banned. However, they have been observing unregulated movement also at borders, and loan repayments of motorcycles and three-wheelers becoming more difficult. In Kenya, increased activities from associations targeting two and three-wheelers. However, loan repayments have also been difficult. There has been a reported lack of movement, and increased violence with police has also been mentioned. In Tanzania, there has been little information released from the government on COVID-19, unfortunately, which leaves us all a little bit in the dark. And in rural Kandete, for example, there has been no observed changes in response to this epidemic. And in Uganda, access to transport services has decreased, and increased arrest and violence with police has also been noticed. Next slide, please. So I'd like to bring this home with just one quote from one of our partners in Uganda, from Makerere University, and she said, "Some people are now not comfortable using motorcycle taxis due to fears of contracting COVID-19. However, people still need to travel to buy food, make essential trips, or to get to health facilities, and the Boda continues to serve communities in this regard. It is also probable that as more people fear traveling to health facilities or even to markets as lockdowns become more widespread, they will rely increasingly on Bodas to deliver medicines and essential supplies to their door. And please remember that in Uganda, a temporary ban on carrying passengers has been put in place. The subsequent banning of large gatherings and the further closure of markets and transport terminals has displaced many Boda riders, meaning they risk harassment or arrest for conducting business away from their designated stations. So this really gives us a lot to think about how these Boda riders are actually being affected, as well as the users that rely on them. Next slide, please. So I just take you through a few images that we captured, that our partners captured and so kindly shared with us. So here in DRC, you can see a popular taxi stand. Riders generally do have masks, but they're being worn around their necks, likely because there's no police or passengers around. And in Uganda as well, the middle motorcycle rider has a mask, but it is being worn around his neck. Next slide, please. Also, this is more of a population perspective, that masks and buying PPE is often difficult for populations, so they're seeking alternative ways to acquire this PPE. So in Kenya, you can see two examples here, people using leaves as a type of mask. Next slide, please. And then we've seen different observed protection measures as well. So in Uganda and Kenya, these are two examples of having washing stations. Clearly in Kenya, this is at a motorcycle stand. And then in Uganda, you can see here that this dividing panel has been inserted on the motorcycles. Next slide, please. So I'd really like to point out the Boda Safety Association of Kenya, and he's actually one of our panelists on the call waiting to answer questions, and I'm sure you'll have some for him. So the Boda Safety Association has actually distributed over 58,000 masks and over 15,000 liters of sanitizer to riders, along with their partners, which include the government, the Ministry of Health, UNFPA, and the National Social Security Fund. So you can see here some of the examples of the materials they've distributed, and as well on the right is one of their motorcycle riders who has his own sanitation equipment on the back of the motorcycle. Next slide, please. And this is a picture from one of their distribution events where they have been distributing all of this PPE material, and you can see it's quite well attended. Next slide, please. So just to bring it home and then to quickly get you to speaking to our panelists, who I'm sure have lots of interesting information to share with you all. Motorcycle taxis are still providing transport services in rural and urban areas. This is clear. And in some places, there's more demand for them than before. They may have an increasingly important role in helping people access healthcare services and medicines, especially as other means of transport might be restricted. And there appears to be limited specific support to this sector, such as clear information, protection equipment, financial support. You could see that many of them were having trouble, for example, repaying loans. Associations in some areas are trying to respond and support riders, which we should very much, we're very proud of that they're able to do this. Riders do not usually have access to safety nets, and so they often have to carry on working to provide for their families, to provide an income, and so they do need our support to be able to do this safely. Also, research has found that many riders have underlying health conditions often attributed to riding motorcycles, including respiratory problems, and that's something very interesting we should be aware of and keep in mind as we are working with these riders. And finally, road safety issues may likely be a concern. Something that we've noticed in London, it has been observed, for example, that the rate of danger per journey has increased, and this is mostly due to an increased speed in urban areas and increased risk to vulnerable road users such as motorcycles, and an increased collision risk. And this could very much be the same case for sub-Saharan Africa. So very interesting also to keep in mind during this time. So I'd like to pass the presentation back to Caroline, who's now going to lead the question and answer session. And please, we look forward to a very fruitful discussion. Thanks very much.
Thank you ever so much, Kim. Thank you for sharing those insights, and thank you also to our many partners who are on the call today and some of the panelists for sharing those images. Really help us understand and see really the reality on the ground. So thank you very much for that. As Kim mentioned, I'll now open the floor formally for the questions. We've had a number coming through as Kim's been presenting, so thank you so much for them. Keep them coming, and I will start to divide them up among our many panelists. So the first question that is coming through for Mr. Mubadi. So Kevin, we have a question on the amount of personal protective equipment and sensitization dissemination you have done is really impressive. What advice do you have for other associations?
Come again, the last part of the question.
Of course, Kevin. The second part was, what advice do you, as the Boda Safety Association in Kenya, have for other associations, maybe in other countries?
Okay, the advice we have as an organization is that our success came from the government, and for the government to be able to believe in you, you must show and prove that you can really work and partner with them. So our hidden agenda, our secret was that we worked very closely with the government before and even during when COVID started. When we came to request for their support, they were ready to work with us because we have shown some track record on the projects that we have been doing, the trainings we have been doing. All whenever we have any function that we do, we always invite the government to come and attend and share their ideas. So what I will advise the other associations in other countries is that they should work very closely with the government, first thing. Then secondly is to reach out to the other partners. We have so many partners who are willing to support the Boda riders, the Boda riders, but maybe they have not reached out to them. So when they reach to them, I'm sure all the partners are willing and ready to support the industry.
Excellent. Thank you very much, Kevin. I'll stay with you for the moment, if that's okay, because we have another question for you, which is, how have you felt that riders have responded to your activities? Do they change their habits after sensitization and receiving your materials?
Yeah, the riders have really appreciated what you are doing, and they are very happy, and it is the first time they are believing that now they can get any support from the government, from other partners. You remember, this is an industry that felt as odd one out. They felt that they are not worthy, but when they see that they can also get something from the government, it is a very positive thing that the riders take with all their heart, and they really appreciate it. So they have changed their behavior, and I can assure you, in Kenya, every rider is putting on a mask, a face mask, which is very important. And other riders are those that have the sanitizer, they are using it to ensure that they sanitize the passengers and themselves. And also in the stage areas where they operate from, they have those tanks where we have some water to wash their hands, and we are using them as peer educators to other people, to other road users and their customers also. So our main agenda was to train them, to train other people, because they meet so many people along the road. So our focus was to train them so that they can also train other people that they'll be carrying, not only the passengers, but any other passers-by near them.
Great, you really do seem to be doing a good job, Kevin. So keep up that good work. We've got some other comments coming in saying, commendations for the work you're doing. Dr. Nono, we'll move across to DRC now. We have a question for you. Do you think that motorcycle taxi riders, do they have access to testing for COVID-19? And what happens if they test positive? What does the government advise that they do? I think you're still on mute, Dr. Nono. We'll try to unmute you, but if you can kindly, that's it, perfect.
Sorry. I was answering that yes, like the whole population, but not in particular for the riders. There is no part exclusively dedicated to the riders, but there is not also any exclusion. At the start of the outbreak, only the laboratory of the National Institute of Biomedical Research was had capacity to test for COVID-19. But currently, various treatment centers have the capacity to perform COVID-19 tests, diagnostic tests, either by rapid test or by gene experts. And a voluntary testing center was made in the principal ground of Kinshasa. And the treatment for COVID-19 is free of charge. So voluntary can go to the depistage center and to test themselves. But it's still a resistance and denial of the disease among some peoples because of communication problem and stigma that arose at the beginning of the epidemic. But if someone is tested for COVID-19 positive, the treatment is free of charge.
Great, thank you so much, Dr. Nono. And it's very interesting the point that you make about stigma as well. I think this is something we are seeing far and wide, unfortunately. Lots of questions coming in, so going to move now to question that's come in for Kim. In the examples of the PPE usage shown, such as using leaves, is this thought to be a lack of medical masks available and a need to comply with local rules, or do you think it's a poor understanding of their purpose?
Yeah, thank you for that question. I actually asked the same question to who we receive these pictures from. It seems to be that a lot of people simply cannot afford masks, and they are reverting to their own homemade styles so that they have some form of protection. They are unlikely that they're aware of the lack of these masks, and so perhaps with additional sensitization, that could be improved. However, shows that populations really need support in acquiring PPE material.
Thank you very much, Kim. So back over to Kenya. Another question for you, Kevin. We have a participant asking, during the research, Kenya seems to have the highest levels of formal training and licensing. What do you think this can be attributed to, and what could have motivated it? I don't know if you have any insights on that for us.
Yeah, the first thing as an organization, when we were set up in 2014, almost 90%, or let's say 99% of the riders never had driving licenses. So our main agenda was to ensure that our people train and get the license. So what we used is that we partnered with the government to sensitize the riders. The other thing is that we partnered with some private schools because the training cost was very high and many people could not afford. So as an organization, we decided to partner with the driving school. We told them that we'll be bringing the riders in masses so that they can reduce the cost of training. Because when you bring like 1,000 people, you can't compare with when people come to class maybe 3 or 4. So that helped us to get the amount of training reduced. Then the other thing that we worked with the other partners to ensure that they finance the training. Have these companies in an area, have these international companies which work in a certain locality. So through their CSR, they used to pay for fees to the riders in that area to be able to train. Also, we worked with the national government and also the political office. The area MPs and the area women representatives, they used to train the riders. We could get the list of the riders in that region. then we can take them to one school, and their fees will be paid by the office of the office of the area MP or the woman representative or the governor of that area, of that county. So those are the tweaks that we use to ensure that as many as possible, as many of our people as possible can be able to train and get this driving licenses. Because we sold this idea to the government that when you have knowledge, it is very, very important. You can't compare someone who has knowledge with someone who doesn't have any kind of knowledge. So the government bought that idea that they should support these riders to get the licenses so that the number of accidents can reduce, because they will have the knowledge on how to operate on the road, unlike if they have not went to school to study this. So this has led to increased number of people with the driving licenses, and we are still moving on. The issue of COVID is the one that has reduced this program. We had to stop because there was no schools anymore and anything going on. There's no crowding. But once the countries open up, we will continue training these guys to ensure that at least we get to over 90% of the riders having this license.
Great, thank you very much, Kevin, and thank you for keeping the questions coming. There's one here for come through for myself. I was involved in the first 4 countries, well, the 5 countries of the study. Thanks for the really interesting and detailed presentation. One question: has all the data on motorcycle helmet use been collected through questionnaires, or has there been observational data collected as well? If not, could be interesting to compare declared use and actual use. That's a really good question. In the research that we did, we interviewed riders and passengers, and we did ask them to self-report. This wasn't actually compared with an observational survey, which would be really interesting and fascinating to do. So thank you for that comment, and definitely will note for future research. Thank you for that one. I have another. Okay, another question coming in. Lots for you today, Kevin, I'm afraid. Are there any women members of your association, or is it all men?
Yeah, we have women. In fact, right now, as we speak, we are organizing for a meeting on Thursday, where we are going to give them what we call Girls Kit. This is a special program for the women riders. And in Nairobi, we have like 20 of them that will be having a meeting with them, with other riders. So we'll be hosting a meeting of 100 riders, but our main focus is now on the women riders, because we want to empower the women riders. So we'll be giving them masks, sanitizers, and the women girls kit, the kits that have everything about a woman, you know, during menstrual cycle and whatever they need. So we'll be giving them in partnership with the UNFPA on Thursday. So we have women riders in Kenya, and I personally took this opportunity to ensure that we support them and empower them and let them understand that this is just a business or a job like any other. And we always say in Kenya that what a man can do, all women can do it better. So we are taking that chance to ensure that we empower as many women as possible to ride motorbikes. And we have quite a number.
Great, that's really exciting to hear. Thank you very much, Kevin. Question coming through here. Do you see an opportunity to use COVID-19 response or support to riders to improve road safety education or to improve road safety regulations for motorcycle use? I'll open that to the panelists if anybody wants to come in and respond to that question. Maybe when I give people the choice, people aren't comfortable to come in. Just a question about, can we actually use this opportunity with COVID-19 to sort of strengthen those relationships you talked about maybe earlier, Kevin, with the government, and start to have or take forward that dialogue to look at issues of safety. Is everything that you've been doing, Kevin, with the recent sensitization all about COVID-19, or have you been able to take the chance and integrate and remind people of safety messages?
Okay, what we have been doing as the Boda Ride Association is that whenever we have these meetings, we always invite different stakeholders. We invite the police for security to talk about security and those. We invite the National Transport and Safety Authority to talk about road safety. Then we have other partners, for example, who can talk about health issues So we combine everything together because this is an opportunity we have brought people together to give them a message. So we are not only focusing to COVID-19. COVID-19 is there, that's our main agenda for the day, but we also bring in these other stakeholders to ensure that they talk about different issues. Like the meeting we had where we were donating unga and sanitizer and masks. We had National Social Security Fund, which is which talked about savings. You know, as the riders, they are young, they're still young people, and they get a lot of money maybe per day, but they can spend it everything. They can spend everything, believing that tomorrow they'll get more funds because you just need to jump on your motorbike and carry one person, 2, 3, 4, then you get your cash. So we are telling them that whatever you make today, save it for tomorrow. So that's why we also bring in those partners like in the National Social Security Fund to ensure that they train riders, they talk to them on the importance of saving for their tomorrow. Yeah. So we bring everyone on board.
That's great. Thank you very much. Got a question here coming from the Bicycle Empowerment Network. Yes, so from that is asking, how far away are we from seeing electric alternatives widely available? So let's ask Dr. Nono in DRC and also Kevin, how far do you think we are from seeing electric powered 2 and 3 wheelers?
Maybe if I could start. Before COVID came in, I had some guys from France, and we had other guys from. We had two different partners who came with they wanted to bring in electric motorcycles. So they had came for the study, and I took them across the country. They met different riders. They asked questions on how they would like their motorbike to look like, what is the best features they would like it to be on the motorbike. So they were to come back after 1 month, but COVID-19 came in, so it had to stop. But for us in Kenya, we are focused, and we are sure that after COVID, we might be having now electric bikes, although we have some in Kenya, but they are not specifically for Boda. So this team was going to design electric motorcycles dedicated for Boda. So very soon coming.
Okay, that's great, Kevin. Dr. Nono, are we seeing electric 2 and 3 wheelers or the potential in DRC?
I think there is no formal education, I don't know, formation for riders in DRC. All the most part of the riders in the DRC learn in the work. So sometimes the Department of Road Prevention organize some formation, some I don't know briefings to help them to know the road prevention on the road specification for themselves. And sometimes the School of Public Health or many other partners organize some seminars for them and to help them to know how to organize themselves and to learn more about how to what comportment they can have in the road, and what can them say do to help themselves to be better. There is no formal education for them in the DRC. There is no formal education for riders.
Thank you very much, Dr. Nono. Another question for you, Doctor. People are asking, or a participant is asking, are you seeing more people trying to access healthcare facilities now during COVID-19, or less people traveling to health facilities? You may be afraid or staying away. What's your observation?
Now, I think that we have found that many people develop a phobia for the hospital during this period. They avoid the hospital for fear of the disease. But for about the transportation for going to the occupation, they still taking transports, and some people, I think that some people's in the beginning it was a slowdown in the beginning of the epidemic, but now people continue to go about their business, and I think that some people found good the restriction because traveling alone on a motorcycle, I think that is better for passenger than when they have 2 or 3 passengers in the same motorcycle.
Thank you very much. Thank you. Okay, let me just look at the other questions coming through. Got a few more. Just to say, if we don't manage to get to you, we've got 7 minutes left, then we will follow up and email you the responses. So don't stop asking the questions. We will get to them all, even if we can't cover them live today. There is a point here, a question. Was the research representing the whole of Kenya and other countries, or rural or urban? So just to explain, the research that was originally conducted in the 5 countries did have a rural focus to the research, and it's now that we're sort of widening that piece out to look at both the rural and the urban area. There's a question here, maybe this one for you, Kim. COVID-19 has shown the vulnerability of informal transport workers around the world. What kind of measures do you think we could look at to improve the well-being of drivers even beyond COVID-19? How can we work better with the sector?
Oh, that's I think the key question is really how to keep them safe physically and with their health, but also, you know, to ensure that they can keep up their livelihood for their families. And I think the key to this primarily is really sensitization and providing them with the protection so that they can keep doing their work, and also just a recognition of local governments that how important they are as informal transport sectors to their populations. And I think that once that is recognized and that the government also offers support, I mean, this could be financial support such as you know, help with loan repayments or relief of loans. This could be just support through education. This could be linking them with other essential sectors. I mean, if I really stretch it, I could even see motorcycles being involved, for example, in the health sector, if they're trained and protected properly. So I do think that they could be key workers, and it would benefit both the transport sector, but also many other sectors if there's just some kind of working together.
Great, thank you very much, Kim. Important points there. There's a comment, so not a question, but a comment come in saying most rider associations in Uganda do not consider formal registration with the government, and that is one reason that they're not targeted in government programs like distributions of masks. Uganda Professional Drivers Network is currently working with riders to create formal associations, so it sounds like there is definitely a pathway here to try to formalize associations, get them registered, and really get some practical help. We'll be sharing the contact details for all our presenters today, and there's a lot of material as well on the Transaid website, on the Recap Rural Access Library. I know that the Boda Association of Kenya has a very active Facebook page, so hopefully you can make the most of those connections and keep the sharing and the dialogue going. I've got a question. Okay, here for another question for you, Kevin. What advice would you have for young associations of motorcycle riders? If you were to start an association now, for example, in a country that is just starting to see motorcycle taxis, how would you go about? What would you start with?
Very interesting. In fact, when the country is starting to see the motorcycle business, that's the best opportunity to have an organized sector of the association. So what they should do, this one should go to the government first of all, and the people in the sector themselves, they should first of all make sure that they register the organization as soon as possible, to have the official document, to have the relationship with the government. Once they have this official document from the government, then they should ensure that anyone who buys a motorbike is first of all registered, because this one also helps in security issues. You can find that maybe different countries have different mode of registration of the motor vehicles and so on. So you might find that this person might buy the motorcycle from a dealer, and the person might not transfer the details, the data information about who purchased this motorbike. And once the dealer sits with the receipt books, for sometimes he throws them away because they don't have that particular detailed contact information. And this motorbike can go outside there and commit crimes. And they can commit runaway crimes. When they try to check the numbers, they can't find who is the real owner of that motorbike. So what they should do is that they should set up a good system where once someone goes to purchase a motorbike, it's first of all registered to the association, so that they can capture all the details, where the motorbike is going, who is the owner, who is going to be the rider, the number plate of the motorbike. They are captured into the organization. This one will be easier to control the flow and the purchasing of the motorbike. And whenever anyone has a question, how many motorcycles are in this country, the association can easily give the right and correct data of how many motorcycles are in the country, and how many people are active riders of the motorcycle at the Boda business.
Thank you very much, Kevin. We have exactly 2 minutes left, so we're going to wrap it up there. A couple of extra comments have come through really saying, please don't forget helmets. I think we all know that's absolutely essential to keep promoting the wearing of helmets. Some people are not wanting to do that apparently in the context of COVID-19 and sharing, but please make sure we keep not just a diversion to COVID-19, there are other very real safety risks facing riders and passengers now. There's a lot of interest, Kevin, so maybe we'll get in touch and put something on our website about how you've managed to get more women involved in the sector. Lots of questions coming through on that. And there is also some questions saying, noting the road safety concerns and looking at, we should also be balancing this with other strategies for using public transport. So that's well noted and appreciated too. So just to say, we will be sending this presentation to everybody that has registered. So the 60 people that are on the call with us now, if you want to access something again, you'll be sent it, or for others who couldn't make the call today. So you'll get that video and you will get links to the documents discussed today. So I think really all that leaves is to say a huge thank you to my speakers and panelists today. We really appreciate, and Grace, we know you're with us. We know we've had a little bit of problems with the connection, and we appreciate you being here. So if there's anything you want to add, we'll send that out to everybody. So to Dr. Nono, to Mr. Mubadi, and to Kim van der Weijde, huge thank you to all, and to all of you for joining today and the great questions. Thank you very much indeed, and please take care of yourselves and each other. Goodbye.
Yeah.